Let me also say good morning and a very, very warm welcome to Dr. Albert Sedohia. He's a specialist psychiatrist at the Kolebu Teaching Hospital. I have the men this morning. Doc, hello, good morning. How are we doing?
Good morning, I'm fine. How are you?
I'm doing all right. I'll also pick your preliminary thoughts about how alarmed you are by the state of affairs when we talk about Ghanaian youth and opioid abuse.
So it's on the rise. We are in the crisis mode right now, and the accessibility has become more because of, we can call evil business people who want it at the doorstep of everybody. It's moved from just misuse of prescription to now getting into the hands of the youth, even without prescription. And they are using it for different reasons. The major reason is because of how the opioids, how it works naturally. It gives a sense of euphoria, a sense of, let's say, highness. So ideally, in other parts of the world, it mostly stems from prescription, where they start misuse and then abuse and all that. But in our parts of the world, Ghana, most of the youth who use it are into hard labor. They use it mostly because they want to work longer, harder. So, and they don't want to eat a lot. They don't want to, so that euphoria makes them work harder, longer. That's number one. Some of them use it to kind of, in quote, boost their sexual performance at that youthful stage. So it's not like a doctor who prescribed it to them or a doctor gave them a prescription for it. Peer influence, economic hardships push them into wanting to do hard labor for longer. So they want something that will boost that effort of theirs. So that's why they get introduced to it. And as it will have it, it's opioid, and it has a very high addictive potential. What that means is when you start using it, after some time, you will need more to feel the same effect. That's when the tolerance begins to set in. And then they continue using. So to feel the same, you need to increase the dose. So they keep increasing the dose and keep increasing the dose. Now, at a point, they realize it's not good for them because it's taking too much of their time, their money, and what they want to use it for, they are no more effective in their job. Because when you use it, you see how they have slurry speech, they become slow.
That's right.
They become sedated. You can't work when you're in that state. So it means your productivity is going to be reduced. So at that point, most of them will know that it's bad for them. But why do they continue using it? Because of the withdrawal effect.
Now, Doc, let's lay the foundation, because I think some of us get confused with the different terminologies. In fact, we hear opioid, we hear tramadol, red. Lay that foundation for us. When we talk about opioids, what is an opioid? And also, is that the same as the tramadol? Is that the name? Give us some education, and then we can go from there, because I'm very keen on some of the things you've just said, talking about sexual function, dysfunction. A lot of the youth have used that as an excuse, but from what the doctors tell us, from what you all tell us, in the long run, the reasons for which they are using and abusing these drugs will come back and haunt them. Yes. So lay that foundation for us so we all know exactly what this opioid, red, tramadol, all of that is.
So it's always good to get clarified. So opioids it's a class of drugs that are derived from the opium poppy plants, or the drugs that mimic the effects of drugs derived from the opium poppy plants. So the general term is the opioids. That's the general. So in the medical parlance, oid means mimic. If you say humanoid, it mimics human characteristics. The naturally existing opioids are the opiates. That's morphine, codeine, and terpene. Those are the naturally existing ones in nature. That's what you derive directly from the opium poppy plant. So opioids is the umbrella term that houses all of these, the natural one, the semi-synthetic, and then the synthetic. Now, synthetic simply means it is produced in the lab for
so it's not
purpose.
From the plant itself directly.
So what you mentioned, tramadol and the rest, these are synthetic, strategically produced from the lab for a specific purpose. And it works in a similar way to the naturally occurring ones that are derived from the opium poppy. Now, all of them work to mimic what happens in our bodies. So in our bodies, we have endogenous opioids. That's the endorphins and the enkephalins. That's in your system. They regulate pain, mood, and hunger. Naturally existing. So if you have some small cuts on your skin, you will not need to take a painkiller. Your body has a way of taking care of that pain, your mood, your hunger. But the thing that we all need to know about these things is that the opioids have a higher affinity it works stronger than the naturally existing ones. It is said they are much more powerful, about 100 to 1,000 times than the naturally existing ones. So when you take them, they're able to work longer than the naturally existing ones. So the endorphins are not as powerful as the tramadol you are mentioning.
Okay.
Now the red you are talking about is something that is not FDA approved. It is a high dose tramadol used by the youth for the purpose of how opioids work. Opioids will give you a sense of euphoria aside the analgesic effect. Analgesic is pain control. So opioids are used for moderate to severe pain control. When it comes to pain management, there's a ladder you follow. There's normal, the mild pain, you use some particular medications, and the moderate, the severe use. Opioids are used for moderate to severe pain control.
Right.
Now, red, high dose tramadol, which is not FDA approved, and is used by the youth, not necessarily for pain, necessarily, but they're using for the euphoric effect to help them work harder, longer. Because these are hard work laborers. They want to use it for that purpose. And I spoke about to boost their sexual activity.
Right.
That's in the short temporary term. But in the long term, it affects your hormones, testosterone. So it makes your testosterone level go down. So then your sexual function diminishes. And then other negative effects, which I'm sure we're going to talk about. So the reason why they start using it mostly is peer influence. So impulsivity. Impulsivity simply means you do something without thinking on it, without thinking about the consequences. So they start using them by impulsivity. But after some time, then it becomes compulsive use. Like my senior man said, you use it to survive, kind of. Because without it, you're going to have severe withdrawal effect. And to have an idea what they go through when it comes to withdrawal effects, just imagine you have nausea, vomiting, diarrhea, abdominal pain, joint pain, headache, agitation, irritation, times 10.
These are the withdrawal symptoms
effects for people who are long-term.
Please go through that again for us.
Imagine that you have nausea, vomiting, diarrhea, abdominal pain, joint pain, headache, agitation, irritability. All of these times 10 at the same time happening to you. So they try to avoid this by just going back to use again, even though they don't want to use. So they start using the drug, and after some time, the drug continues to use them.
Dr. Alberts, I'm hearing a lot of things this morning, things that I didn't even know. Talk to us about the psychology behind this. He says, that was Alidu. He says, when you take it, you feel like a gangster. You know, you are the top dog in the ghetto. It brings about some aggression. He says, if you are a rider, and a lot of them, he says, are hooked on it, you see them riding, it's not for anything, they're on drugs. He said, when the wind just passes over you, you have that invincible feeling. Is this true?
Okay, so before I go to that, let me touch on some of the few things that Honorable did and Dr. Also. So when Dr. Richmond was talking about the pharmacist level, in pharmacy shops where they are well-trained pharmacists, it is easy to control. Dr. Anaba made it clear. When a prescription comes, you want to investigate and be sure who wrote it and where it's coming from and everything, and they're able to suspect quickly. They have the dangerous drug book and all that. But most of the pharmacy shops don't have pharmacists. They have MCAs, medicine counter assistant, who may not be so savvy in these kind of things. And of course, when you go outside of these, there are a lot of chemical shops that don't have even pharmacists, or some of them are not even MCAs who are trained. I have a lot of clients who are using some opioids, Petidine specifically, among a lot of people, and they get it from pharmacy shops without prescription. So they know somebody's on it, they know the person, they just go and get how many vials, 10, 20, 30 vials, without prescription. It's business as usual for them, just like Dr. Richard said. It's just business, it's good business for them. The person is hooked onto it, and when you come, they get it for you. When you go to Okanshi drugstore, I have a lot of clients who just walk. So when you ask for Petidine, they'll tell you there's none here without prescription. But as you continue walking, somebody will approach you. How many do you want? Follow me. So there's a whole cartel as evil businessmen behind it. They'll pretend they don't have it, but as you walk along, somebody will come to you and then begin to sell to you. And then you talk about what causing people. Of course, from the two people who are talking on that, Alidu and our friend Kofi, peer pressure is big. But one thing that we mostly lose sight of is a lot of people are using these substances because of underlying, unrecognized, untreated mental illnesses. Depression, anxiety, PTSD, ADHD, a lot of mental illnesses underline why they use it. Because it is unrecognized, untreated, undiagnosed, when they take these drugs, the way they feel, they like it. Because maybe their mood was lower and has been lower for a long time because they are going through with some financial stresses, work stress, or whatever it is they are going through, some form of stress. When they take these substances, the way they feel, they like it. So they just want to keep on feeling the same way all the time. That is what makes them continue using it. Underlining untreated, undiagnosed mental illness. Also, it's a two-way affair. Using it can also precipitate and perpetuate mental illnesses. So when you're on any of the substances of abuse, not just the opioid, you have cannabis, alcohol, all of them, when you continue to use them, it can also precipitate and perpetuate mental illnesses. So it can precipitate it, and it can be the reason why the person may be using. So that's self-medication unawares because of how they were feeling before that. Now, most people wouldn't be willing to come out to talk about it because of the strong stigma.
That's right.
In the society. They just write you off. You are a drug addict. You are so and so. That's why a lot of people don't want to talk about it. And that's why a lot of people don't even come for help. You see? So there are lots of people who are there who are not coming out. Now, Dr. Richard also made something clear. Manual workers. You notice he's naming them for you. Construction workers, Okada riders, long-distance drivers. These are manual laborers.
In fact, this is my first time hearing that.
Galamsey sites.
Riders.
Heavy.
Okay.
Galamsey site. All manual workers, Galamsey site, and some criminals, armed robbers, and they all use this. And they don't only just use the red. They mix it with energy drinks that has that high in caffeine. And some also use codeine-based cough syrups. So people mostly don't just use the red or the tramadol, the high-dose tramadol. Why? Because, you see, it's a way of chasing the high. When you use it for the first time, how you feel, you may not likely feel like that ever again, but you always want to feel like that. So after using the red for some time, you may want to add something else, caffeine, a stimulant. You want to add something else, maybe cannabis, alcohol, a mixture of it.
In fact, Alidu says the cannabis is like a top-up.
It's a base.
That one, he says the effects, you just add it to it. But
yes.
With the caffeine, if you mix this with the caffeine, I mean, can your heart handle that kind of pressure?
When it comes to substance of abuse, tolerance is where somebody said a lot of peers can use a whole pack. And you're like, how? It's not too surprising. Because like I said from the beginning, when you start using it, after some time, your body becomes used to it. So you need more to achieve a similar effect. That's when tolerance begins to set it to the point where you can use a whole pack or two. We have people who are using the dose. We tell you, like, how are you able to survive it? Because of tolerance. Now, everybody should be aware of the fact that opioids in general can cause sudden death, respiratory depression. So you can die from opioids because of the tolerance. You keep on dosing and increasing the dose, increasing the dose to the point where you just die. At the work site, at home, or wherever you may be hiding.
So you could be on construction site, lifting blocks, your heart will stop.
Because he said something, which I also want to focus on. He said, because it's oral, you took it, it's being absorbed into your bloodstream. That is why he's describing, he's giving you a practical experience. That's someone who knows what he's talking about. We are just helping with the medical understanding of it. So he said, because as you drink more water, it's being absorbed into your bloodstream. That's when it begins to peak in your blood, begins to work. And then after some time, he says, he feels weak.
Yes.
Sedation sets in. So the euphoric phase is what they like, but they don't like the sedation part. The sedation part is where they feel slow, they become slurry, they are drowsy, they can't do what they set out to do. And the second person, Alidu also made it very clear that it will start helping you, but after some time, it will leave you on the bench. That's exactly what we are saying, that testosterone level will go down after chronic use. The reason why they seem to perform a little better when they use it in the interim is because of the euphoric effect, the dopamine effect. It increases dopamine. That's what gives the euphoric effect and all that. That is why they seem to have all that. But people need to also know that most people don't just use the red. It's a cocktail that a lot of people use. Energy drink with it, codeine-based syrup, alcohol, cannabis. Some even go as high as adding others like cocaine and others. It's a cocktail most of them use because they're just trying to have high from a lot of substances together in one person because tolerance has set in, but it should be made aware that you can die because it can depress your respiratory center, something that other ones may not be able to do. Like cannabis may not do that, but opioids can easily do that. We call it overdose. You just die from it. So, and then he said, sometimes he feels like spirit is calling him to use the
him.
drug. A lot of people say that. That is compulsion.
Yes.
So I said there's impulsive phase where you use it because you didn't think about what it's going to cost to you, what is going to happen to you when you use it, the negative effect. You're not thinking it through. Just peer pressure in the moment, party or something, you just use it. That's impulsive. But when tolerance begins to set in, you need to use it to somehow survive. That's compulsion. Compulsion is fueled by withdrawal. Because the withdrawal effect, like I told you, nausea, vomiting, diarrhea, abdominal pain, headache, agitation, all that times 10, if you don't take it, these feelings is unbearable. That is why they need medical attention. Of course, I know we are going to come back, but you ask about the impact, the psychological impact.
That's right.
First is what we'll be talking about so far, addiction and dependence because of tolerance. It's highly addictive, and they should know that. You cannot just stop on your own easily. It's not easy to stop opioid. And from the clinical point of view, opioids are very difficult to treat, even in rehab. So we always advise residential rehabilitation at least 6 months. They don't do well with the outpatient rehab because it's very addictive. You are likely going to fall back.
Especially if you are in the community where there's a lot of it available. Your colleagues are still using.
Availability, accessibility, affordability.
And then peer influence.
Fueled by peer influence. So it's available, you can afford it, and it's accessible. And then peers will say, oh, try. That's it. Like there's fuel and there's, you light a match. Boom. That's so affordability, availability, and accessibility fueled by peer pressure. And then it worsens all. So opioids are dangerous. The interim, the temporary benefit they seem to get are never long lasting. The euphoric effect, which makes you want to work longer, it's never long lasting. The sexual boosting, it's never long lasting. And it can kill you because it has tendency to depress the respiratory center. So addiction and dependence is one of the psychological effects. And I also spoke about the fact that it can precipitate mental illnesses, long-term use. And of course, addiction itself is a mental disorder. It's a chronic brain disorder. It's not just moral failure. When they become addicted to it, it's not because they can't control themselves. There are changes, structural changes in the brain. That is the reason why. And for every substance of abuse, now we're talking mainly about the youth.
That's right.
The frontal lobe, prefrontal cortex, which controls your judgment, your decision making, your impulse control, matures after 24 years. So when you expose drugs to before that time, the changes there are mostly long-lasting. I just don't want to use the word permanent because there is some hope because of neuroplasticity and all that, but it's very long-lasting. If you expose yourself, your brain to it before the maturity, imagine that you don't know, you don't have good impulse control, good decision-making, all these, because after 20, it only matures, the brain matures from back to the front.
Doc, you have put the fear of God in me.
We need
morning.
you to have that so that a lot of people get
this
it clear.
Is very, very, very
because
serious.
It's a dangerous drug.
Dr. Alberts, the weaning off of the drugs, the rehab, there's some detoxification that occurs. How does that usually go? How difficult is that?
Okay, so the first phase is the detoxification, which has to be done in a medical facility because, especially with the opioids, it's quite difficult to get off on your own because of the withdrawal effect. It will get you going back to use if you don't get help. So there's medication-assisted treatments where you come to the hospital, we admit you between 5 to 7 days. Some people use 7 to 10 days, depends on the severity. We give medication to ameliorate, to kind of help you with the symptoms, like you are going to have vomiting, diarrhea, nausea, pain, headache, all that. We're going to give medication to take care of also symptomatic relief. It's not addiction is not curable. You will continue to be in recovery when you stay off the drugs. But we are giving medication to make it easy for you to cope with the withdrawal period whilst washing out whatever is in your system. That's the detoxification phase. Beyond that, what we always recommend is immediately after that, for opioids specifically, we will advise you to go for residential rehabilitation. And you see, many people don't know this, but Pantine rehab is the best in Ghana right now in terms of resources and everything. I mean, you don't have the best facility in terms of the structure or whatever, but they have the best trained staff in the whole country. Doesn't matter whichever rehab you may mention, but Pantine is the best. They may not have the structure that fit AC or whatever, but in terms of the staffing, the qualifications of the staff there. They have psychiatrists, psychologists.
Expertise.
They have all the expertise that you need for. They use the therapeutic community system, where people who are in recovery or who want to start the journey, they learn best from their peers, and then guided by experts. So in that environment, most of them lose activities of daily living. That's why you see Alidu saying this day he doesn't dress well. It's not because he doesn't want to dress well. It's because when you are dependent on these drugs, all your preoccupation is now how to get the drugs, how to use, and how to avoid withdrawals. That's all your preoccupation. So you prioritize using the drug to every other thing. How you look doesn't matter. Food doesn't matter. Relationship, socialization, work, nothing matters apart from just getting the drugs, using, and trying to conceal so that other people may not find out that you are using. So detoxification, medication-assisted treatment, then after that you go to the rehab. Now for those, some people who can be managed, you go to the outpatient basis, where we have some in Accra Psychiatric Hospital, Kolebu, and also Panta, and a few other places as well. But you see, some, for opioid, we always advise residential rehab. Now, Richard said it clearly. Treatment is very expensive. I can give you figures. Pantine, a month is about 6,500. You're going to be there for 6 months. If you put everything together, you need about 50,000 Ghana cedis.
Just to start your journey.
Start the journey, 50,000 Ghana cedis. Because I'm talking about detox phase, residential rehab for 6 months, your food, medications, and sometimes we have dual diagnosis, where the drugs of abuse has precipitated a mental illness. Could be psychotic, psychosis, depression, anxiety, whatever, PTSD. People with ADHD, children with ADHD, are at a higher risk of substance misuse. Typically, all of them, cannabis and all the others. So you see, it can be dual diagnosis. So we are not only treating the addiction, we also have to treat the underlying cause of what it's precipitated, and then the complications of the addiction. You understand? So you need to have a behavioral modification in a setting where you have experts to guide you, not just something. So there's no quick fix. So some people want to just go for, say, 1 week or 1 month or 2 months rehab.
That is simply not enough time.
No. There's no quick fix. They need to first of all know that addiction is not curable. It's a long-term journey. You need to allow yourself to be treated well. You understand?
Right.
So and also you have to, on the market, a lot of the evil business people have resorted into innovations. When they knew tramadol was now being targeted, they changed the name to something else. Now, from even the red, now they are on tafrodol. And because they want you to be hooked on it, they use the tramadol, and now they are adding other chemicals to the tramadol in the combination. That will make it more addictive. For example,
so all synthesized in the lab.
All synthesized. So you see the mind behind it. So for example, tafrodol, the issue that came on the BBC story, it is not just an opioid. It's tapentadol, which is the opioid, mixed with carisoprodol, which is a muscle relaxant. So, and it's also very addictive. So they want you actually to be hooked on it for longer, so that you keep coming for more, because they know it will be difficult for you to get off it. And the effect on the family is what we don't talk about.
Gentlemen.
Another thing that we don't talk about, which is looming in the background, is vaping.
Is vaping. And I think that's one that we have to table for a very serious conversation.
There should be early signs for you to tell if your kids are involved.
Exactly.
Okay.
Early signs. If your kid has become very secretive, there's decline in academic performance, associated with the wrong group, now no more socializing, becoming irritable at home, becoming disrespectful towards you, suspect them, be close to them, talk to them. That is where it starts from. The schools, especially secondary schools.
Boarding houses.
Let me say a very, very big thank you to my doctors in studio.